Hi, it's Terry Kuti of Deep Sea Foundation. We are here to have a conversation to help patients in consultation and care through their decision process for treatment, surgery, recovery, and survivorship. If you are a surgeon or a healthcare professional listening, please hit the pause button when you need to and take notes. These are surgeons who have built a footprint of success for you with their practice caring for those affected by breast cancer. I want to acknowledge the ARSA, that's the Advanced Reconstructive Surgery Alliance Network, and their leadership for allowing this time and space for me to do these interviews for you, the listener. Please share them with those who you think can use the information, and I will have contact information to find a surgeon who may be able to help you. It will be at the end of the video in the credits. So with that, let me introduce my guest. I'm speaking now to Dr. Eric Weiss, who is a board-certified plastic surgeon as well as a board-certified general surgeon. And he received his Bachelor of Science in Psychology from Duke University, so you're a Blue Devil.
Yeah.
I had to bring that up. I mean, we're recording this in March.
It's been a good year.
Are they still?
Started to rub it in.
Are they still at the top of the leaderboard?
They just re-achieved the number one spot. So.
Oh no. Well, we didn't come here to talk about basketball.
We can do that.
I know. I can feel that from you. So, but we're going to segue into your work, Dr. Weiss. So, he went on to complete his general surgery training at Einstein Health Care Network in Philadelphia, where he was awarded the DAS, did I pronounce that correctly?
That's correct, yeah.
DAS Award, congratulations, for the most outstanding chief surgical resident. Dr. Weiss continued his education by completing a 3-year plastic surgery training at the University of Pennsylvania. His outstanding scholarly record is a testament to his knowledge and dedication and mastery of the education he received. What I find very important to our discussion today with Dr. Weiss is that more than anything, he values the relationship he develops with his patients and takes pride in giving them a natural and personalized result, which is very important in breast reconstruction surgery. Dr. Weiss collaborates with a team of surgeons. They practice the co-surgeon model.
We do.
This is in Florida, and they perform breast reconstruction surgery as part of the Institute for Advanced Reconstruction Network of Physicians. So, Dr. Weiss, you are with Vanguard Plastic Surgery tell us where that's at.
It's located in the heart of Fort Lauderdale.
Okay.
Which is a short drive north of Miami, south of Boca Raton. That's where our primary office is. We have a secondary satellite office in Boynton Beach, which is about 30 minutes north of there.
Okay.
In our office, we perform kind of a broad array of simpler procedures, cosmetic stuff like eyelid surgery, tummy tuck, mini tummy tucks, liposuction. We do quite a bit of hand surgery there, fracture management, tendon reconstruction, scar care, stuff like that. Minimally invasive cosmetic stuff like radiofrequency microneedling, laser treatments. We also have a full-time esthetician who's amazing. She does chemical peels, overall skin care. So that's where we're primarily located. Beyond that, amongst the 4 of us, there's 4 surgeons. I'm one of 4. We just added a newer, our youngest surgeon yet, who graduated his plastic surgery residency about 6 or 7 months ago.
Did I meet him last night?
Dr. Gamma, yeah.
Yeah, can you just briefly tell us everybody's name so the listeners are...
He's Amon Gamma. He's about 7 months in practice now. Jim Fletcher, formerly the program director at the University of Minnesota. He's been in practice for roughly 14 years or so. We have a private practice, and the owner of the private practice is George Strezer. So it's the four of us. We work closely together. We cover a territory of about 75 miles. Dr. Gamma covers a territory that's a little bit further north than the rest of us.
Okay.
I personally have privileges at about 15 locations throughout South Florida, and do quite a bit of surgery at all 15 of those.
Wow.
Between the four of us, we have privileges at about 20 to 25 places. For outside of the office, we do more of our complex stuff, which includes extremity salvage procedures, patients who have undergone or have sustained severe mangling accidents from motorcycles or car accidents or everything you can imagine in South Florida. We do quite a bit of skin cancer reconstruction, which is abundant in South Florida. We work closely with other surgical disciplines to reconstruct patients who have needs and complications from their surgeries, such as orthopedists, vascular surgeons, cardiac surgeons, thoracic surgeons. We do head and neck reconstruction to reconstruct mandibles or soft tissue reconstructions as a result of facial or head and neck cancer. My personal focus is on breast reconstruction, microsurgical extremity salvage, nerve repair and reconstruction, and facial and breast cosmetic surgery.
Okay, that is a lot of microsurgery. So let's swing back to the breast reconstruction. I'm really glad you covered all of the procedures that you do, but we are going to go and focus on breast reconstruction right now. But I want the listeners to understand how important all of these procedures that he spoke about are in terms of his work with breast reconstruction, because it's sewing blood vessels together. That is a unique skill that takes extra time, extra practice, extra schooling for these surgeons. So in the setting of a breast cancer patient or someone who is at high risk for breast cancer, talk to us, Dr. Weiss. How important is it to discuss aesthetic expectations with these patients? It's a fine line. When you have breast cancer, I think a lot of times when patients come in, they don't often go to the aesthetic realm, but they should be.
Well, everybody has different goals and expectations.
Sure.
Setting expectations is critically important in everything that I do.
Yeah.
Chief among those in breast cancer reconstruction patients. The majority of patients who come in are actually pretty savvy. They've spoken with friends or family. Unfortunately, breast cancer is ubiquitous. So they've spoken to friends or family who have had breast cancer frequently, have undergone a reconstructive procedure. They've done a lot of their own research. They've seen pictures about incisions and so on. And so they understand the gist of things that can be accomplished or experiences that patients have during a breast cancer reconstructive journey. They come in with all kinds of preconceived opinions about incision types, flap types, personal anecdotal experiences of others, types of implants, everything you can imagine. Yeah. Which is awesome for setting a foundation for further discussion.
Yes.
However, everyone is dramatically different. Even within a patient's own right and left side are frequently different. Aging, personal experiences, breastfeeding, pregnancy, sun exposure, everything you can imagine dramatically alters the appearance and consistency and the quality of the breast. So what is possible or the best option for one patient isn't always the best option for another. So It's really important for me to establish, a relationship with the patient and discuss all of the options that are available, and then to describe to them why I think certain options might suit them better, but ultimately, it's their body, it's their choice. I'm looking to achieve, whatever I can to meet their goals within the realm of whatever is possible, in a safe, and efficient manner.
Wow. Achieve their goals in the realm of what's possible. I like that statement. That's a good statement. So, once the patient has, left the OR, what is the follow-up at your practice? Because a lot of patients often wonder, they're under the care of the doctor prior to surgery, but then you guys have to have a support staff. You're in the OR most of the time. How do patients follow up with their surgical care once they've had breast reconstruction at Vanguard?
So throughout the entire process, preoperatively starting there, I usually meet with the patient at least 2 times before we undergo surgery. The first meeting is to develop a relationship, to discuss all of the options that exist for breast reconstruction, and then again to discuss why I think certain things might suit them better than others. That can be an overwhelming experience. So we usually have at least a second meeting to kind of refine a plan. Before surgery, they're given a thorough set of instructions. We go over expectations. I go over what their experience, what my expectations are for their experience.
Sure.
Every breast cancer reconstruction patient is given my personal phone number. So I'm always available to them throughout the entire process, them and their family. If for whatever reason I'm not available after the fact, somebody from my practice, one of the 4 surgeons, is available 24 hours a day, 7 days a week. So they can always reach somebody. We have about 17 employees who are very well versed at this point on how to deal with anything that may arise in the post-operative care of the patient. Drain management, drain falls out, something clogs, there's a little bit of delayed wound healing in one location. We've honed in and developed a very efficient system to effectively manage anything that may arise to, keep patients as comfortable and confident in their care as possible.
Nice. So you mentioned your other team members. Can you just tell us from your perspective what the value of the co-surgeon model is? Because I really encourage patients to seek institutions, practices that are using the co-surgeon model. There's just studies done that show it's of great benefit, not only for you, but for the patients. So what, from your perspective?
Absolutely invaluable in my practice. We always do microsurgical breast reconstruction with at least 2 of us. These can be long procedures, sometimes 12+ hour procedures to do deep reconstruction on both breasts. Which we cut down in half that time with the addition of a second, experienced, knowledgeable, capable surgeon. Oftentimes we'll use 3 or even 4 of us doing the same, procedure at the same time. It's super helpful to have somebody completing an independent portion of a procedure while I'm doing something else. Dramatically reduces operative time, anesthesia time, thereby accelerating patient recovery, improving overall outcomes, reducing complications. And also honing that aesthetic outcome too. So it's extremely helpful. With that said, we have lots of help. We have Jim Fletcher. He was instrumental in the inception of a new Broward Health Plastic Surgery Fellowship, of which he's the program director. So we have full-time fellows that work with us at the facility where we do most of the deep flaps.
Okay.
And at pretty much every location, I have ancillary help from either residents or mid-levels or something like that. So we have lots of help, but nothing really takes the place of an experienced surgeon who really knows. These are very specialized, nuanced procedures. So,
they are. They are.
As you're familiar with. So it's super helpful to have at least one co-surgeon with me to perform these procedures.
And I imagine too, I think I've always, I've mentioned before in interviews, but also I've told patients, sometimes you have to do a plan B or do a little bit of a pivot when you're in surgery because something unplanned happens. I would think that having a co-surgeon with you.
Absolutely.
Yeah.
I mean, it helps troubleshoot anything that may arise. Each of us have had plenty of our own individual experiences, so we may be more familiar with one thing than another. All kinds of things that can come up. Blood vessels clotting off, twisting of vessels, individual perforator anatomy, which is the blood vessels that feed the skin and the fat of the flap that we dissect. Scar tissue that might envelop these blood vessels, and somebody might have a better trick at dissecting through this than others. So there's all kinds of things that can arise. So just having a second set of eyes and experience is immensely helpful.
Yeah. I'm going to throw a question at you I didn't put in the script. Do you guys, because you were talking about surgery and everything, do you guys use any form of ERAS protocol?
I've sort of extrapolated one from my time at Penn where they have one. It has to do with the types of medications we use. We reduce the narcotics. We kind of give a lower level narcotic. We inject long-acting pain medications in the belly walls so that patients feel good. We encourage early ambulation, early feeding, reduce the operative time so that anesthesia washes out of their system quickly. So the average patient spends about 2 to 3 days in the hospital after surgery. And we're toying with the idea of reducing that further.
Okay, great. Well, I'm really glad to meet you. I'm hoping that the Blue Devils are very successful this year.
Me too.
But I really enjoyed talking to you about your practice at Vanguard. So again, we're talking to Dr. Eric Weiss at Vanguard in Florida, and we do these interviews, Dr. Weiss, really, from my perspective, it's to provide access to care for patients, but also to provide the education. So I appreciate your time today in covering both of those.
Absolutely. Thank you for having us.
Yeah.
Thank you for spreading the word about what we do. Thank you for doing what you do and helping to care for our patients and spread the good word about, breast cancer care and reconstruction.
Yeah, it's all about options and choice. Yeah, good talking to you.
You too.
Thanks.